Hey friends, welcome back to Blueprint Nursing NCLEX Reviews. My name is Nicole, and today we'll be doing a practice NCLEX question. This one will be about arterial blood gas interpretation. Intimidating, I know, but you're going to rock it. And I'll be with you every step of the way. Before we begin, let's do a quick ABG refresher. Okay, I know ABGs can seem intimidating. Luckily, the next-gen NCLEX now offers the normal lab value reference ranges, so you don't have to worry about memorizing them. However, I would highly recommend knowing a rough range and definitely how to interpret them. Once you know what's going on with your client, you can implement the appropriate interventions. Let's start with reviewing what an ABG actually is. An ABG, or arterial blood gas, is an analysis of a blood sample taken from an artery. Now, what does it exactly test for? Do you remember? It can actually tell us several things. It tells us a level of oxygen and carbon dioxide in the blood sample and balance of acids and bases in your body. This is also referred to as the pH balance of blood. So, why do we want to know a client's acid-base balance? Well, the kidney controls the bicarbonate levels and the lungs control the carbon dioxide levels. Acid base and pH levels are a result of how well the kidneys and lungs are working. If there is a problem in either of these organs, we may see the client move into an alkalotic or acidotic state. When you come across an ABG question on your NCLEX exam, there are a couple of values that we need to know and how to interpret them. What are those? These would include the blood pH, which tests acidity versus alkalinity, carbon dioxide, which is an acid, and bicarbonate, which is a base. As I mentioned a minute ago, the NCLEX provides us with reference ranges, so we get to focus on the interpretation of those values. Based on client's values, we'll be able to determine the client's acid-base balance or imbalance. A helpful method for ABG value interpretation is the mnemonic Rome. Have you heard of this before? Any ideas of what it stands for? Yeah. Respiratory, opposite, metabolic, equal. But how do we use Rome? When we talk about Rome, we'll use arrows to represent whether a given value is low, normal, or high. If the arrows point in opposite directions, we'll consider them the opposite in Rome. If the arrows point in the same direction, we'll consider them the equal in Rome. Using this method, we'll look through the pH, carbon dioxide, and bicarbonate values to determine if they are low, normal, or high. Based on their values, we'll draw the arrows. Based on where those values land, or where our arrows point, we can determine the client's acid-base imbalance and whether or not it's respiratory or metabolic in origin. Okay, let's try our hand at an ABG interpretation before we get to our question. This one will be a no fuss, bare bones interpretation to get the hang of it. We'll do this one together to get the feel for it, and if you need to pause to slow down, go for it. Just like on the NCLEX, you'll be able to see the reference ranges on the table. A normal pH value is 7.38 to 7.44. Anything greater than 7.44 is considered alkalotic, and anything less than 7.38 is considered acidotic. The client's pH is 7.29. Is that within normal limits? No. So let's draw the arrow pointing downwards. Their carbon dioxide is 51. Is that within normal limits? No. So let's draw the arrow pointing upwards. Their bicarbonate is 24. Is with that in normal limits? Yeah, so we can just draw a dash there. Are you ready to interpret these values? Let's do it. If we use Rome, where does that put our client? Well, first, let's determine if we have an acidosis or an alkalosis scenario here. We see that the pH is low, which has us asking if the client is acidotic or alkalotic. Yeah, acidotic. Here's our first piece. When we use the arrow method, we notice that the pH arrow points down and the carbon dioxide arrow points up. So the arrows are pointing in opposite directions. With the pH and carbon dioxide values pointing in opposite directions, we can interpret the demo ABG as respiratory acidosis. And this created an acidic environment, hence respiratory acidosis. Great work. Now are you ready to try an NCLEX style practice question based on the ABG results? Let's do it. Which of the following clients would you expect to see based on the following ABG values? pH of 7.49, a carbon dioxide of 39, a bicarbonate of 31. Option 1. A client with a blood glucose level of 427 milligrams per deciliter and positive ketones in their urine. Option 2. A client who has been experiencing frequent episodes of vomiting over the last 48 hours. Option 3. A client who is on a patient-controlled analgesia pump with a respiratory rate of 8 breaths per minute. Option 4. A client who reports episodes of anxiety and hyperventilation over the last week. Pause here and we'll link back up when you're ready. First, we'll discuss the correct answer, then we'll briefly talk about the other options. If you answered 2, a client who has been experiencing frequent episodes of vomiting over the last 48 hours, you got it. So how did we get here? Let's go through it. First, where would you place each of these values? Looking at the pH level of 7.49, would that be low, normal, or high? Yeah, high. What about the carbon dioxide level of 39? Normal. You got it. Okay, what are we thinking about the bicarbonate level of 31? High. That's right. So let's look at the pH first. How do we know that this client is alkalotic? Well, with the pH, we remember that the higher the number, the more basic. That makes this client alkalotic. So now that we know that they're alkalotic, how do we know that this client's alkalosis is metabolic or respiratory in nature? Well, let's remember that helpful mnemonic Rome. Which value is abnormal, and where does it sit compared to a high pH? If we look at the high bicarbonate level here, we notice it is equal to the high pH on the visual. That gets us the equal in the Rome mnemonic, which means it's metabolic alkalosis. Great work. So now we get to the next level of the question, and we'll identify which option reflects a client presenting with findings that align with metabolic alkalosis. When we're looking through the options, we're looking for a client that is getting rid of an acid and retaining a base, creating alkalosis. Can you think of what might cause this? This can be caused by several things, such as diuretic therapy, total parenteral nutrition, or even loss of gastric fluids. And are we seeing an option with loss of gastric fluids? Yeah. Option 2, a client who has been experiencing frequent episodes of vomiting over the last 48 hours. So I'm going to have a very silly tip to help remember this particular cause of metabolic alkalosis. Think of what vomiting sounds like. Alk, alk, alk. Alk, like alkalosis. Yeah, like I said, silly. So here's a question that is helpful to consider. If we were the nurse caring for a client with metabolic alkalosis, what do we expect the provider to order? Maybe electrolyte therapy? Maybe the provider will discontinue any drug they believe to be causing the alkalotic state? Maybe symptomatic treatment. All of those things are possible orders depending on the client. It's always good to anticipate interventions. All right, let's do a quick run through of the other options. First up, option 1, a client with a blood glucose of 427 milligrams per deciliter and positive ketones in their urine. Any guesses, friends? The hints here are a high blood glucose level and the ketones. Do these two together ring a bell for you? This is a possible client with ketoacidosis, which the name is a giveaway. So now we know this client is an acidotic client, but is this respiratory or metabolic acidosis? Metabolic, yes, because of the kidney involvement. Next, option 3, a client who is on a patient-controlled analgesia pump with a respiratory rate of 8 breaths per minute. This client sounds oversedated. The hint here is respiratory rate. The client is not blowing enough carbon dioxide. If the carbon dioxide is not leaving the body, where is it going? Nowhere. They're retaining it. This client is a client that would be experiencing respiratory acidosis. Lastly, option 4, a client who reports episodes of anxiety and hyperventilation over the last week. Okay, so we see the client is also experiencing respiratory symptoms, which gives us a hint that the imbalance is respiratory in nature. Let's look further. The client is experiencing respiratory symptoms like the last client, but this client is blowing off too much carbon dioxide. They're getting rid of their acid. So this client would be experiencing respiratory alkalosis. All right, friends, we made it. Another NCLEX style question down. Acid-base imbalances can be tricky at times, but give yourself time. Come back to this video, create scenarios of your own, and quiz your peers. Most importantly, remember your Rome mnemonic. Thank you so much for joining me today. I'll see you soon.